Hello, welcome back, everyone. I'm Roxana Polonio, Vice President of TTAG, and also a psychologist and teacher of primary school. I hope you enjoyed the first part of our session and found it inspiring and practical. We are now moving into the second part of our webinar on Tourette awareness in educational settings, where we will go a little deeper into the challenges and best practice when providing awareness training in schools. It is a pleasure once again to introduce to Kathy Giordano, Chair of TTAG International Education Committee and an international leader in Tourette awareness. Kathy has over 30 years of experience helping schools, families, and professionals understand and support the students with Tourette syndrome and related conditions. And she has served as education specialist for the Tourette Association of America, where she developed nationwide programs, research, and training models that have inspired professionals across the USA and beyond USA. What makes Kathy's work so special is her ability to connect science, empathy, and life experience, helping educators feel both confident and compassionate when responding to student needs. In the second part, Kathy will share key insights on how to approach schools with empathy, respect, and timing, focusing on connection rather than confrontation. Kathy, thank you for being here with us once again.
Yeah, thanks, Roxanne.
Yes.
And I will add in, one of the reasons that I've been doing this for over 30 years is I have a passion, and my passion comes from the fact that I have three children. Two of them have Tourette syndrome. My youngest was diagnosed at the age of 5 with very severe Tourette and a lot of the comorbid issues. So that's where my passion comes from.
Okay. Thank you. Thank you for all your experience and to share all this experience, professional and personal experience. And now we're just going to go to focus on challenges when providing awareness to the training in school, Kathy. What challenge can we find?
Do you want to go to the next slide?
Yes. One of the first topic that we usually to ask ourselves when we are preparing a presentation is what kind of information are we going to share?
Right. So I think one of the major challenges is getting the schools to welcome a presentation. And as we talked about in the first webinar, I have found that one of the best ways to do that is to have the parents request the presentation and introduce the person that's going to present. And if they don't want to do it right away, keep asking. The parent can keep requesting that it be done. And it lots of times as the year goes on, the school will see the necessity more and more and more for a presentation. So I think that's one of the major challenges is to getting the school to actually agree to having the presentation. So what
Yes.
kind of information? I think we're focused on awareness, and I think we can't provide too much technical information because it can be overwhelming, and we want awareness. We're not specialists necessarily. That's not the goal. We can't give the answers. I know when we go in to do a presentation, educators want the answer. They want the answer for this specific student or a bunch of students, and we can't give. Every kid is different. So we can't necessarily come up with, this is what you do. We can provide strategies. We have resources where there are some strategies to consider. So I think that can help the educators kind of develop a plan. But so we will include some data because the schools want, a little bit of data, but mostly they want information. They want walk away. They want to walk away with something that they can use, and that helps them be more connected to the student and have an awareness that remains with them, because the data is going to leave their brains. Um, but when we can give them some awareness in a way that is impactful, then it will be remembered and it can be useful.
Yes, people remember useful information.
They
Yes.
do, and they do remember. They remember stories. So we want to start out with a short video. And TTAG will provide you with the video that we think can be useful, and it is pretty short. And it's a young boy that has Tourette, and so it kind of hits the heart, and that's what we want. We want to touch people's hearts. So because to connect emotionally with clear information and to touch their passion for being teachers. I mean, they're teachers, they want to
Yes.
help students. So touching their hearts is a good way to get the information across. Again, we don't want to go too deep into uh, information, because everybody's different, and so we wanna bring the awareness. We will keep saying this over and over and over again throughout these webinars that awareness is the answer. Um, and we also will provide a video that can be used at the end. That's a positive story and inspires people. Look, there is hope for this kid. There is most people with Tourette do make it through school and into the adult world, even though it may not look like it in the moment, because it can be very frustrating for teachers. So we want to have the awareness and inspire, because inclusion is possible and inclusion is important.
Yes.
Um, Exclusion doesn't help. So
Absolutely.
giving information and awareness that can support inclusion is one of our goals.
Okay. So very, very, very clear. What kind of information in emotion, information that connect emotionally, no? Because we want to
Hmm.
create awareness.
Right, right. Thanks.
So we'll pass to the next. Okay, here. Mm. And that is another important topic that our experience uh, make us to share this. Not all schools are going to respond in the same way, and we have to be awareness about this for
Yes.
our own expectation about the presentation that we make. Mm?
Hmm.
So why it is important to take into account this topic, Kathy?
Yeah, and I've presented to thousands and thousands of schools across the U.S. and some of them, they're truly committed to inclusion. So they're like, everything you have to say, they welcome, and they really want more information in a positive way. They want to be positive. We want to encourage um, positive and proactive rather than reactive punishment. And teachers mostly, want to be positive. They don't want to be wardens. They don't want to be mean to students. So some of the schools, you can tell they're committed to inclusion. And I think it starts from the top up,
Mhm.
because I've seen some situations where you can tell that the teachers want to be positive and inclusive, um, but the superintendents or the principals don't support it, which puts the teachers in a very hard situation. Um, so sometimes it's they will seem engaged, but then the follow through isn't so great. And then there are the highly rigid schools that really don't want to hear what you have to say.
Yes. Unfortunately, there is
Yes,
many of them. Yeah.
those are the ones that you might have to work a little harder. One of the things that I think is important is for people to like me,
Mhm.
because if they like me, they're more likely to hear what I have to say. And I even try to, I mean, even within the US, there's a whole lot of different cultures.
Mhm.
And I try to dress in a way that's accepting of the culture.
Mhm.
Um, I'm not a fancy person. I am who I am, and I think that comes across really well.
Mhm.
Um, so I dress in a way that I'm hoping people will see me as a person, um, rather than a
Like
person
them.
than yes, rather than facts.
Yeah.
So, because I think that is helpful. And I think that leads to, like it says here, the lasting change. Um, I have met teachers that I presented to years and years ago, and they will come up to me, and mostly it's a story that they'll relate to me.
Yeah.
So, then I know, I've made an impression. Um, so TTAG's approach, obviously, we want connection, not confrontation. So we don't go in angry. You don't want to be an angry person. I fortunately am a parent, like I said, of three kids, but my son being so severe, um, I had a positive experience with his schooling, which you don't always see that. So I could go into the presentation in a positive way because my experience was positive. You don't ever want to talk about, well, this teacher did this bad thing. Don't do that.
Mhm.
Talk about teachers that were positive, because we want to build bridges, not walls. And by talking positive, we create trust and interest. We need to demonstrate that to the schools that we're there, to be helpful, that the organizations are there to be helpful. So, and absolutely, you'll hear us say 100 times that Tourette looks different in every student.
Yeah.
So, recognize that. So, um, when um, I don't know if you want to introduce this one.
Mhm.
Personal
Okay.
personal stories versus general awareness.
Yes. This is another thing that we wanted to create a balance when we are creating a presentation. We have lots of personal experience to share because almost every presenter has a personal connection with someone who has Tourette syndrome. It is our son, our daughter, our patient, our perhaps the person it is who has Tourette syndrome also. And how to create a balance between personal story and general awareness. Um,
Yeah, yeah, I think that's really important because the educators, they need to perceive this as information that they can use. They want takeaways. And if we talk it's a balance because I think the stories demonstrate our passion,
Mm-hmm.
and it's stories that will be remembered. But teachers want to walk away with information. They want to have a walk away. This is what I can do. And
Mm-hmm.
if we tell too many personal stories, then the teachers may think, this really wasn't helpful to me. Um, it was this person's personal journey, but that's not helping me teach the student that I have or students that I will be teaching in the future.
Yeah.
So our approach, we encourage trainers to use personal stories with care and purpose.
Yeah.
Um, Whenever I use a personal story, and I do use personal stories, I don't use a lot. Um, and if I do want to use something from my family, sometimes I'll say that it was somebody else. I'll say that it was, this person that I met a long time ago, or I met last week, or but it could be a story that I'm familiar with. But use it with care and purpose. Whenever I tell a story, it has a purpose.
Mm-hmm.
Um, I think back on there was a little girl in fourth grade that I was helping, and the teacher called me one day and said that this is not Tourette. Every time I say we're going to have a test or a quiz, she says, "Shut up." And I said, "Well, see, that's her Tourette speaking. Everybody else in the class is thinking, 'Shut up,' or worse.
Mm-hmm.
They're able to inhibit it. She's not able to inhibit it because of her neurological makeup. It's not that she wants to say this. So, and that story, I hope they remember that this cute little girl, would say, 'Shut up.' And so the teacher says, 'So what do I do? Do I just accept it?' And I said, 'Well, you accept it, but you also help her learn strategies because we don't want her going the rest of her life telling people to shut up.'" So,
Of course.
so helping her figure out how to manage it. And what we ended up doing, I said to the teacher, "Are you okay with the student just making a grunting noise?" And she said, "Yeah, I can do that." And so I said to the girl, "Can you make a grunting noise rather than saying shut up?" So that worked.
They work.
So
Okay.
yeah, so I can use stories like that. Um,
That they can, that in, I am thinking that uh, information that can, that teachers can understand about the case that they are trying to understand,
right.
and also um, they can understand another conditions. When you talk about inhibition or disinhibition, you are not talking only about Tourette syndrome. There are another condition that also has disinhibition. So it is very useful for them to learn about Tourette syndrome because they learn about another conditions also. Yes.
I find that to be true. I was talking to some people the other day talking about disinhibition, and so many people don't understand disinhibition. The brain isn't able to inhibit. They don't. The kids don't want to do these things. They don't want to say these things. And I'll talk more about this in the next webinar. But the woman said, "Oh, this makes sense to me." And I have a daughter that has and I forget what it was, but it was a different diagnosis.
Yes.
And she said this information about disinhibition really helped me.
Yes.
So
Of course. Uh,
yeah.
so well. And when we talk teachers, another things that we perceive, that usually perceive, it is some feelings about guilt and emotional overload in school teams. So what important is mm, be sensible and empathize with these feelings uh, with the school teams. Um, what do
Yeah,
you
I
think?
do find that unfortunately, teachers go into the profession because they want to help children. And when a lot of children with Tourette are bright and but aren't being successful, or they're cute as a button and say something that's really not a good thing to say. And
Mhm.
so teachers need to understand, they need to have this awareness so that they can be accepting of the student and demonstrate to the other students acceptance. But a lot of time we enter the presentation and especially when we do a small team meeting, which sometimes I will do just with the students team, and they do feel guilty because they want to help this child. They know that the child can be successful, and whatever is going on, they're not being successful and they don't know what to do because they have all this information that they learned in college on how to work with typical children, and they have worked with typical children, but kids with Tourette are not typical. And so all the typical interventions oftentimes don't work. And it ends up with the teachers feeling guilty, um, feeling like they're not doing enough, that they've made mistakes, that they're failing the student. I have heard a lot of times teachers will come up to me and say, "Oh, now that I know this, I remember there was a student I worked with 5 years ago, and oh, I did it all wrong, and I feel so guilty about that." And I really try to downplay their guilt because they were doing the best that they knew how to do in the moment,
Yeah.
and so we can't feel guilty about it because they didn't know.
Yes.
If you don't have the awareness, then you can't be guilty. You can't feel guilty. You just move on. You move forward. Now you have the awareness, so you can help this student as well as students
Yes,
in the future.
many, yes, many teachers that doesn't know that some behaviors are related with Tourette syndrome feel a bit surprised about this when they found this connection that when especially when we share the experience in during the presentation, and we have to it is important to care the teacher, uh,
Hmm.
as you
Hmm.
mentioned. It is important not only care the children with Tourette, but also the teacher, because he or she is going to be all the year with them, and it is important that we, as you mentioned, create bridge and no, not destroy bridge.
Right. Right. I don't want to judge. I don't want to come across as being judgmental, or correcting them. I go into a presentation with a clean slate and recognize that they're teachers and they're this is hard. Being a teacher is hard.
Yeah.
And so I just want to help them. I don't want to make them feel guilty in any way. And so one of the things I always do is I start out by thanking them for being teachers, especially in this day and age. It's hard, and so I thank them for attending this, for being interested, and for caring enough about the students. And I acknowledge constantly, like Roxana just said, there's there's behaviors. It's more than ticks. People have come to a place where they may recognize Tourette, but they have blinders on that it's only tics. So if a kid is having problem with sensory issues, we need to know that that's a common related challenge for students. And we will give information on a lot of the common challenges that go along with Tourette because that can be very helpful. People don't know that handwriting is a very common difficulty for students with Tourette.
Yeah.
So acknowledging the complexities of it, Tourette is one of the most complex disorders going. It's
Yes.
the kid can be acting perfectly typical in the morning, not having any symptoms and doing the work. And then by afternoon, the symptoms explode and they stop doing the work, and we question why, but we
Yeah.
need to figure out why,
Why?
because the Tourette is so complicated.
Yes, it's
Um,
more than ticks. And
And I
when
like
we
to I
have,
like to validate what they're doing right. I was in a meeting recently, and there was a little girl that needed to drink water quite frequently, and so she was in a class of computer technology, and so the teacher didn't allow drinks because you're sitting in front of a computer, and so he didn't allow for the students to have water. So the little girl started being disruptive, and the principal was called in, and the principal said to the little girl, I got an idea. Why don't you take your water and either go to the back of the room or off to the side of the room and then have your drink, and then you can come back and complete your work. Well, I mean, I could not have thanked that guy enough.
yes,
I,
but
I,
what important is validate what they are doing right.
right,
Absolutely, I agree because in many cases the relationship is going to be created by because they are unique between this teacher and this pupil. I remember a girl who has her tics became suddenly in during these first years of the tics of teacher didn't know what to do with her, but the girl uh, asked her to take her hand. So when
uh,
he has many tics, he goes close to the teacher and give me the hands, she said. And the teacher give the hands, and they created this connection, this emotional connection, no verbal connection, but it was enough for this girl to copy with the tics this first year, and that is it is not written in anywhere, but it is the connection that they found, and and that was a fantastic research for her. So what important is validate what they are doing right.
right, right. Because kids with Tourette have a lot of mountains to climb, and a lot of people do judge them. So when they find a teacher or an educator, or counselor, or principal, or whomever that shows respect and shows a caring, that goes a long ways. It doesn't always end up being perfect, but it does go, it goes a long ways and is so. One of the important things I talk about when I'm presenting is that there needs to be one person, at least one person in the school that believes the child, that the child sees as a safe person,
Yeah.
and that the child can talk to. But I love that, hey, the child knew enough to ask the teacher to hang on to my hand, and that helped.
Yes.
Perfect.
Yes.
Lovely.
Yeah. So, uh, common context for Tourette awareness. What important it is to take into account the context where we are going to provide awareness. What is the best context? Are there
I
best
always talk,
context?
yeah, I always talk to the parents first, to find out what is the context and how do the parents feel about it. I also like to, when possible, I like to talk to a teacher, a counselor, because I want to know what they're seeing at school that they.
Mhm.
So when I do the presentation, if a child is having problem with sensory issues, I will bring up sensory issues. If they're having problems with social, I will bring up social. So that's the context. I need to know that information. But I also need to make sure that I'm as much as possible meet the teacher's needs. That the teachers see it as being relevant for them. And again, having some walk away information. Otherwise, they may say that, it didn't work for me. Um, so again, I talked to the parents. Um, we really want proactive inclusion. Excluding a student with Tourette
Mhm.
doesn't work. Um, a lot of times students with Tourette are excluded anyways. So by having a school-wide awareness, there's inclusion with the kids, there's inclusion with different classes, um, and responding to a real need. Um, we need to talk to the parents about the timing, talking to the school about the timing, get consent, because we don't want to. Um, we want to make sure that the family feels safe with
Mhm.
what we're going to say and what information we're bringing, so that it does build trust, um, not only between me and the school, but also trust between the school and the family. Um, and sometimes the student will say, "Well, I don't want you saying my name." Then respect that. Other times, students don't care; they want people to know.
Yeah.
So it really depends on the information that you get.
Okay. Okay. And it is important always to take account the timing of of the school. No? Um, it is the training may mm, we have to take account if it is the adequate time for the school to receive the information,
Mhm.
um, because the risk is to feel blame or to be like in a defensive um, way to listen us, and it is not useful for nobody that teacher feel
Yeah.
defensive in a defensive way.
And there's some presenters that really like doing the presentation prior to school. I personally like it after a month or after the teachers have some experience working with the student,
Mm-hmm.
because then they're going to have specific areas that they have questions of. So yeah, and it seems to me that like right now I am super busy because in the United States, school has just started, and so I'm getting a lot of calls from schools that have questions,
Mm-hmm.
and so yeah, the timing is important so that they will be open to the information.
Yes, of course. So, well, and there is an ethical timing. Mm? It, and it is very related that when it is very related with we have talking about, um, it is choosing the right moment.
Mhm.
There is a not a right moment for all. No,
No,
no.
no. With Tourette, every part of Tourette, there's no one size fits all. Um, so not only with the timing, but with the symptoms and with the strategies, and so again, is it always at the beginning of the year? Maybe. Um, it really depends on the situation. Like Roxana was saying before, that we really need to figure out when is a good time to do the presentation. Um, and again, to validate the family's privacy and create a comfortable atmosphere for the family and the school to work together.
Yes, and it is very important to include the child's perspective. If it is their time that the school team know about their tics or not,
Mhm.
they 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 have to be confident that when we notice to the teamwork, to the teamwork of teachers, this guy has Tourette syndrome. It is important to include the perspective of the child.
Definitely, yeah, and that's why before I do any of my presentations, I really like talking to the family, to find out, um, the child's perspective on the whole thing, and the family's um, needs and desires too, because I want to make sure that I dignify um, their story, their needs. If I just go in and don't do that, then I'm not doing anybody a favor.
Yes, of course. Um, well, mm, Kathy, what important is all these challenges take into account these challenges. There is some question that I wanted to make you now because I think that many people perhaps could could ask themselves. So one of this question is, what advice would you give to new presenters who are just beginning to lead, to lead awareness sessions in school, and perhaps might feel unsure about how much information to include? When is too much information? When it is enough information? When it is not enough information? How can what do you recommend when you create a presentation? What is the criteria that you take into account for this?
Yeah, I think it's hard. I think it's like a lot of what we've talked about. It's a balance. So it's a balance of not providing too much data, not providing so much information that they're overwhelmed. You want to provide the information that is going to help this specific group. So finding out, that's why I really like to talk to somebody from the school ahead of time, to find out where their attitudes are. And if you're a new presenter, um, my college friend used to describe me as not wanting to blend into the wallpaper, but I wanted to be the wallpaper. I was the shyest person that you ever wanted to find. So if you're shy and you think you can't do this, you can. Because be aware that I can guarantee you, and this is what helped me when I first started. Um, I was pretty confident that I knew more about Tourette than anybody else in the audience.
Mhm.
So that helped me be confident in developing a presentation and presenting the information. There were times when I remember a doctor early on just got really angry at me and said that I didn't know what I was talking about, and that these kids just needed to be on heavy duty drugs. And fortunately, he left right after saying those things. And so I said
And
to the
how
rest of the
difficult to be to not to react in this moment in that moment. It is
yeah, I
difficult,
couldn't
yes.
react because it would have destroyed my credibility.
Yeah.
So I mean, fortunately, he left, which was which was good. Um, And I
Fortunately,
sort of, yeah, I said to everybody, well, everybody has their opinions,
yes.
and
Her
he's a
opinion.
doctor, and obviously he believes strongly in medication,
Yeah.
and I have seen that we can help students. Yeah, sometimes they do need medication, but we also can help by understanding, by holding the little boy's hand. That didn't take a doctor's saying to do that. It just requires some compassion. and some caring and understanding. So yeah, not freaking out when people say things that are
Yes,
you know
and I am thinking when listen to you, Kathy, how important is to work in ourselves, in not react with negative comments or be compassion uh, just in this moment where when people still couldn't understand what is Tourette. And
right,
yes,
right. We need to be compassionate
yeah.
with the teachers that they don't understand. And one of the things that I learned early on too was to never tell negative stories. We don't want to tell a story about a teacher who did something really bad because that's
Mm,
not going to be helpful. We want to talk about the teachers that did the positives.
yes,
Like Roxana, what you were saying about the little boy asking to hold the hand. That's positive. You know,
yes.
that's not like, well, the little boy, I mean, there could have been a story where the little boy asked the teacher to hold his hand and the teacher says, I'm not going to hold your hand. That's not a good story.
Yes, exactly.
Yeah.
So, in another question is in your experience, Kathy, what are some of the most effective ways to build trust between teachers and families when a child with Tourette is struggling at school?
Hmm.
Um, mm, how?
I personally, yeah, I, and a lot of people might disagree with this. I personally feel gaining that I gain the most trust with the school and the parents is to meet with the team. Um, I think general awareness presentations for the whole staff is great because then there's an awareness. But I think you develop trust and relation by sitting down with the teachers and answering their questions. When I do this, I tell the schools that if they'd like, I could meet with the team to answer their questions. I never say that I'd like to meet with the team so I can tell them what to do.
Okay, yes, I was thinking the same. It is very important that feel that we are a team. We are not someone who are going to say what to do with.
Right. Right.
Yes,
Nobody wants to hear that.
eh,
Nobody
eh,
wants to be told.
yes,
So, but by answering their questions, you can educate them. there's
yes.
a there's a lot of awareness that can come from like with the handwriting thing. So if during a team meeting one of the teachers says, well, this little boy refuses to write, I can say, well, typically a lot of kids with Tourette do have difficulty with handwriting. So it's a matter of figuring out, how else he can get the thoughts from his brain onto the paper so that he can be successful. So that's bringing awareness just by the teacher asking a question.
Yes, yes, and when they awareness about the relationship of these behaviors, such as handwriting difficulties and Tourette, they can change easily their attitude. If you can explain that both of things are movement disorders, because handwriting disorder, it is a kind of movement disorder, and Tourette syndrome, it is a movement disorder. The connection, it is very clear, no? So
Yes,
they
yes,
they can be aware that, oh, I can mm, the child has I can help the child in this. Uh,
yes,
yeah.
yes. And I think there's
Mm.
trying to explain and trying to get across the common challenges, because again, a lot of people will know about tics, but they're not going to know about sensory issues.
Mhm.
And there was one little boy that I was meeting with the team, and he was perfectly fine in every class except for one. And so I went to the class, and the class just happened to be next to the cafeteria. The smells from the cafeteria, this boy could not manage. So, by telling a story like that, that really shows how unique this can be too. Because
Yeah.
you wouldn't think that.
Yes,
You
of
would
course.
you wouldn't think that the food smells would increase the symptoms.
Yes, of course. So, um, Kathy, thank you. Thank you very much for sharing with us all this experience that is going to be so useful for people who are have to go to school and explain what is Tourette syndrome. And on behalf of TTAG, TICS, and Tourette across the globe, we hope you keep this dialogue alive in your own communities and school. So next week we are going to have our third webinar, and it is this is a very nice webinar, Kathy, because you are going to share your own presentation for school. Is that so? It that right?
Yes, yeah. And I'm not like going to do the presentation, but I'm going to share my slides and say why I use this slide, why this information works. So I think I think it is one of the important webinars that we can offer.
Okay, so we hope to see you again. Take care, everyone, and we'll see you soon for our next session in the Tourette Awareness in Educational Setting series. Bye bye.
Bye. Thanks, Roxana.